Thank you, Noreen. Just checking to make sure that you can hear me okay. And I got a thumbs up there, so I will proceed. Thank you, Noreen and Leah, for the invitation, and Noreen for that introduction. So I will just, in about 45 minutes or so, give you an overview of how I think about pandemics and what they reveal. As a historian, I should begin this by making it clear that I am not a demographer. I'm not a quantitative social scientist, but I do study numbers because of what lies behind them. And as a historian, I am interested in recurring patterns and new patterns in the history of illness and the history of pandemics. And this is really what I want to bring to your kind of awareness today. The study of inequalities that are revealed and accentuated in the course of pandemics. Now, graphs like this really highlight not what I would say, and basically I've organized this talk in maybe 15 or 16 points that I want to make. And the first is that graphs like this, which is just pulled from the New York Times this morning, that tracks new cases day by day of COVID-19, highlights not one, but multiple kinds of disparities. They're the kinds of disparities that came into view early on as the US surpassed 11 million infections, in which one saw the story of Black and Latino Americans, Native Americans shouldering an outsized burden. By the end of 2020, headlines like this were fairly prevalent. The year inequality became less visible and more visible. This is a story by Emily Badger, also in the New York Times, that highlights that the disparities that are associated with those who can work remotely, like us, and those who are really compelled because they are deemed to be essential workers, or their vital work brings them into more persistent interaction with the virus and raises the risk of exposure, infection, and death. And then as vaccines emerged on the scene, a new set of disparities emerged, in which you saw articles this past May on a class gap in vaccine uptake, vaccine hesitancy, and vaccination more generally. The biggest gap, this article suggested, isn't based on race or partisanship, but it's based on class. And then more recently, a new line of disparities opening here just in the United States, captured by this article titled just a couple of days ago, "The unvaccinated are 11 times more likely to die," CDC says. So we have now this new moniker, the epidemic of the unvaccinated. So what you're seeing here is it's certainly one pandemic, but these two waves, if you want to just isolate these two, are really revealing two very different kinds of inequality. So my first point is that the first wave, I'm just calling it a wave. I mean, it's actually the third wave, you could call it. But in the first major bump, we see the underlying reality of higher positivity rates for Latinx populations, American Indians, African Americans, predominantly people who work in food service, home healthcare, non-remote work deemed essential, as in meatpacking plants, people who live in multi-generational households or live in densely populated communities where social distancing was more prevalent. These are the inequalities that were unmasked. In the more recent wave, which is a post-vaccination wave, we see new disparities emerge, not just in the US, but globally, captured in May here in another chart from the New York Times. The pandemic's fault lines continue to widen as vaccines flow towards rich countries. And then in the United States, the notion that the vaccines, these divisions, are themselves giving rise to new kinds of blame, anger, and fomenting particular social divisions. In this case, the anger not towards those who are unvaccinated from those who are. So for historians like myself of medicine, of health, of disease, the present is colliding really dramatically with the past, because these themes, blame, inequality, anger, racial and class inequality, they're very familiar themes in the history of pandemics. Whether those pandemics are cholera or yellow fever, which came in waves over the course of the 19th century, or the much discussed influenza pandemic from the 1918-1919, which produced a comparable number of deaths to that which we're experiencing today. A third point is that pandemics have always been seen as a revealer of the face of poverty. And this goes back to Defoe's observations in the Journal of a Plague Year, which documents retrospectively the devastation of the plague in London, in which Defoe writes that the infection kept chiefly in the out parishes, which being very populous and fuller, alas, of poor, the distemper found more to prey upon than in the city. And here you have an image of a city that's very differently configured today, not an inner city of poverty, but an outer city, a ring of poverty that surrounds a more affluent and wealthy inner city. But this is where the face of poverty comes into view in the case of the plague. And this theme recurs with cholera and yellow fever in the United States and also across Europe in the 19th century. But there you begin to see, as you did in plague times, the way in which these epidemics could be catalysts for reform, for calls for reform. So cholera in New York afflicting people that were deemed to be inhabiting the most populous and central portions of the city really becomes a shocking revealer of something that is really happening in 19th century, the burgeoning of new cities like New York. And cholera is also conceptualized from 1832 to 49, and then ultimately in 1866 as a driver of new class disparities, and ultimately a rallying cry for different kinds of social reform, whether it's quarantines, street cleaning, the closing of the ports, a familiar theme of how to whether and how to restrict commerce in the name of public health, is a recurring theme, you might say, in how societies grapple with pandemics, and also become the basis for calls for public health reform. So one of the things that one sees in the wake of pandemics is a call to expand the reach and power and role of government in the lives of citizens. Writing more than 50 years ago in his still classic book, The Cholera Years, Charles Rosenberg noted that to Americans, the extent of poverty revealed by the epidemic was genuinely disturbing. And he notes that a Cincinnati editor observed that if the disease was caused by poor food or poor lodging, filth, and intemperance, the number of victims gives us a melancholy idea of the present state of society. So pandemics as judgment on society in some way. And by 1866, cities like New York and ultimately other cities are turning towards something that we take for granted today, the creation of permanent boards of health to oversee the health and well-being of the population, even in non-pandemic times. And this is what leads towards a new robust kind of governance around pandemics, the rise of what we would call vaccination mandates today, which become the topic of really inflamed public conversation around smallpox in the 1870s, 1880s, peaking in the 1890s, and ultimately arriving at the US Supreme Court in 1905 with the much discussed Jacobson v. Massachusetts ruling, in which the Supreme Court recognizes the right of the state of Massachusetts to mandate vaccine in the name of protecting the public health, despite whatever objections individuals might have about this being an overriding of personal liberty. So pandemics often, it may take a long time to play out, advance the reach of government into the lives of citizens. Now, even as this goes on, one of the things that we've learned from previous pandemics like the influenza pandemic is the way in which information moves around in often unequal ways. There is historically a desire to inform the public, and there is also an emerging conversation about the politics of personal responsibility that comes into view most glaringly in the case of the influenza pandemic. In fact, if you look at influenza, there's a reason, I think, why today we tend to look back to the influenza pandemic, because it has so many parallels with what we see unfolding in the politics of public health and personal responsibility in COVID-19. You don't have to really dig deep into the historical record to see discussions about, what to do about droplets sprayed from the nose and throat, that the illness is seen as spread through coughing and sneezing, instructions on how to sneeze and cough properly, in this case with a handkerchief, the call to avoid crowds or to walk to work rather than taking the trolley. Right. So there's a reason why the influenza pandemic really is a touchstone and reference point for many of those who are thinking about parallels with COVID-19. And there's also a kind of ethos of personal responsibility, articles like this from a Milwaukee newspaper instructing the public on how to make an influenza face mask. And you can find many of these. There are detailed instructions on how to cut gauze paper and how to turn it inside out and how to secure it to your face. Despite the fact that masks were fundamentally new, not just for the public, but also for the medical profession at this time. Not surprisingly, then as now, there were pretty robust, although I wouldn't say they were as robust as today, protests over the policing of public health. The influenza pandemic saw not just masking as a public phenomenon, but also protests over masking. In this case, in San Francisco, thousands attend a protest meeting where mask opponents denounce a city ordinance. As the fine print says, an audience that filled Dreamland Rink last night at a protest meeting against the compulsory wearing of influenza masks declared its intention to appear en masse before the Board of Supervisors tomorrow to demand that the ordinance be repealed immediately. So these tensions over masking, I'd say one of the inequalities that's revealed in the course of pandemics is the ideological divide. Pandemics are a study in the distrust of both the trust in government, but also the distrust of government, especially the expanding public power of government. So, torn from the headlines in Denver, Colorado, November 1918, police will enforce the flu masking order. So empowering the police to act in the nature of really public health police. Seattle, Washington, and you begin to see glimmers of a kind of a different sort of skepticism. In this article from Seattle, protest voiced to gauze mask rule, some Pacific Coast cities becoming restive under orders of health department relative to so-called epidemic. So then is now a question not just about masking and proper public health or prevention practice, but also questions about the reality of the, quote, so-called epidemic. Then as now, we have a kind of the ideological divide that produces a flourishing of unproven drugs and theories. So well before ivermectin and hydrochloroquine, we have a familiar history of specious theories thriving in 1918 about gargles and germicides and inhalers, which are keeping pharmacists busy. Face atomizers are running out of stores because people are looking to grab and grasp onto any possible way of really securing their health in the midst of this pandemic. And political cartoons like this by Charles Reese, which you can see the influenza storm cloud right at the top of the image, looming in the horizon as citizens from far and wide run to ye old and good germ destroyer store, looking for distilled and bottled for ye kindly gentlemen. or new preventives appearing in the newspapers left and right, like Wilson's solution, placed on the market and is now on sale by leading druggists in Denver. Speaking of Denver, I just want to highlight the way in which the tensions surrounding the proper way to safeguard health in Denver then references and echoes with today. Police enforcing masks, regulating anti-influenza masks and the proper way to adjust it, public information, but also theater men protesting the mask and really looking for a way to perhaps open more deliberately and quickly in the face of these restrictions. That was Denver, Colorado, November 1918. This was Denver, Colorado, April 2020. An anti-mask protester facing off against a masked healthcare worker. This is kind of an iconic image from early in the pandemic, one of many epidemic divides. Today's inequalities, of course, also come in a wide range of varieties. And I want to spend a couple of seconds talking about the mask divide as a broader kind of divide about identity. The masking is in today's world, unlike 1918, is much more highly politicized as a personal statement. And this became clear throughout the 2020 and still remains the case today. And it was a kind of political and politicized statement that's supported by an information nexus, by the rapid movement of information through new, highly efficient pathways that are also underpinned by theories that are constantly sort of being thrust into the social media, debunked, and new theories emerging, whether it's about hydrochloroquine or ivermectin or the mask. So this is just pulled from a July 2020 story that the Mayo Clinic chooses to run that tries to debunk myths about face masks. And one of the most prevalent, you might remember from last year, was the myth that wearing a mask will increase the amount of carbon dioxide that one breathes and make one sick. And the Mayo Clinic was compelled really to acknowledge this myth and its spread, and to also point out that there is no risk of hypoxia, which is lower oxygen levels in healthy adults. Carbon dioxide will freely diffuse through your mask as you breathe. The reason why I kind of highlight this particular myth about masks is because it's how it became entangled with the inflammation of a particular identity politics in 2020 that still continues today. And it's captured really by this anti-mask protest in the Midwest, in which this gentleman with the blue hat wears a sign that says, "Fear, read your fear of COVID does not trump," a term chosen deliberately, "does not trump my right to not breathe my own CO2." And, you know, in a year when the question of course, there's no evidence for this, but in a year when whose breathing matters, and "I can't breathe" became a kind of rallying cry, not just for social reform, but also for statements about vulnerability and identity. You can see these two claims about whose breathing matters and whose breathing was interdicted by whom becoming not just a story about the coronavirus and not just a story, but also a story about identity and government, whether policing or what kind of policing one should be subjected to in modern America. To sort of move towards the conclusion, and I'm actually moving more quickly than I thought I would, there's also, of course, an underlying racial politics of epidemics and disease. For historians who have studied the politics of yellow fever, cholera, influenza, HIV/AIDS, it's no surprise that there is a profound culture of blame, fear, and personal security that can often be manipulated and inflamed by pandemics. It's captured in this 2020 cartoon of Donald Trump using the phrase Kung flu to describe the coronavirus. And it's also captured decades, a century earlier, by this image. I mean, the difference, of course, is the influenza pandemic did not, or this is actually about tuberculosis, but tuberculosis and influenza did not have a president who was trafficking so explicitly in racism and these racist tropes. I want to break down this image, though, because I think cartoonists historically have had a really great way of capturing some of the tensions as well as the inequalities that pandemics or disease can engender. This is actually from Atlanta, the Atlantic Journal and Constitution newspaper in 1910, and it really captures something of the politics of race, blame, and fear and security circa 1910. It shows a domestic servant, a Black woman, who lives in a house that flies the flag of contagious disease. And she, because she's a domestic worker who works in the, quote, average white home pictures, she must transport herself. Now, this image shows her transporting herself with flies and vermin who are known to be the vectors of disease, past and over the river of filth, but also significantly over a wall that's designed to protect the average white home. And that wall is constructed of sanitary precautions, screens, pure water, medical science, garbage cans, and good sewage. So this is an image of that's kind of carries with it a sense of blame and responsibility and accusation, and also upholds the idea that it is the average white home that is a threat to the assaults of the racial other. And so it's these kinds of themes that we see recurring both today in the Donald Trump's language in 2020 and still today across media. As William Faulkner once said, and it's a quote that I like to repeat whenever I give talks, the past isn't dead, it's not even past. So one of the interesting things, one of the challenges of thinking about the inequalities that are revealed by the pandemic is just the multiplicity of them. That even as the new vaccine politics creates new disparities of the pandemic of the unvaccinated, the familiar and deadly inequalities that really were part of that first wave that I described endure and manifest themselves in multiple ways. This is why I say that for historians of medicine and historians of disease that have studied pandemics of the past, it is as if the past that we have long studied has collided with the present. And as one of my colleagues once said, we're seeing ourselves in the history books that we have written long ago. Books like Alan Kraut's Silent Travelers on germs, genes, and the intersection between ideas, germ phobia and anti-immigrant attitudes. Books like that of Nayan Shah, who wrote Contagious Divides, Epidemics and Race in San Francisco's Chinatown. And also a book about Baltimore in the early part of the 20th century and the politics of epidemiology, the politics of numbers, Infectious Fear by a colleague, Sam Roberts at Columbia, product of our history department here at Princeton, Politics, Disease, and the Health Effects of Segregation. So just to wrap up, and as I said, I'm kind of going much more quickly than I expected. What I'd like to close with is just some observations about what pandemics reveal about society, if one were to just collect some of these observations. And to give you a sense of how a historian thinks about disparities is that I look at the numbers, but I think it's much more revealing and interesting to look behind the numbers. And in so doing, what we see is diverse social dynamics that drive and accentuate inequalities in the course of pandemics in general and this pandemic in particular. We also see that pandemics don't reveal one inequality, but really many. And across the states right now, we're really seeing that in some ways we have 50 plus pandemics that are unfolding because of the differential policies that have been endorsed from Florida to New Jersey to Vermont to Idaho to Washington State to California and Texas. What we're living in is an experiment that is created by the system of federalism in which we live. So not one pandemic, but many. And I suspect that when the history of this pandemic is written someday, it will be written, or it should be written, not as one singular affair, but really many kind of comparative stories playing out. It is also, however, the story inevitably, I mean, a year ago, somebody said, what are we to expect? And I said, well, historians aren't really futurists, but because we've seen pandemics play out so frequently in the past, what we can say is that pandemics of this global and national significance are the basis for expanding the reach of government and public health, despite the controversies surrounding the scope and character of that reach. Then inevitably the role of government will expand and has expanded, and it will then produce debates. The other thing we can say about COVID-19, and this is kind of specific to COVID, is that I don't recall another pandemic in which the evolution of the virus was so persistent and such a dramatic phenomenon that it suggests that the tail of this virus, the tail of this pandemic, will be long. In some ways, it is more reminiscent of HIV/AIDS. That is to say, HIV/AIDS has been with us for 40 years. We live with HIV/AIDS. We have not conquered, we have not vanquished. We have in some ways subdued it by transforming what was a deadly acute illness, a pandemic, into a chronic disease that can be managed. So if I were to say there's a lesson in COVID-19, or there's a lesson from the past about COVID-19, I'd say that the parallel for what is likely to play out may look a lot like HIV/AIDS. That is to say, a virus, a biological organism that is prevalent and maybe becomes endemic across the globe, that continues the challenge for government of management. And as a result, I say that COVID-19 will have a long tail. And these debates that we've become all too familiar and tired of in the last year, debates, angry partisanship, debates over proper means of therapy and prevention, not to mention the inequalities in the uptake of the vaccine or the distribution of the vaccine, both nationally and globally. These will endure. And as a historian of medicine, disease, pandemics, and society, what I'd say is, in some ways, people look back to the plague and they say, well, one of the things that the bubonic plague across Europe did, because of just the enormous devastation, demographically speaking, it decimated an entire economic system that was rooted in feudalism, serfdom, and in some ways, over the course of decades and centuries, led to a transformation in the economy. I don't think that COVID-19 is necessarily heading in that direction, but I do think that its effects will be lasting economically, politically, socially, and certainly politically. And in that sense, I'd like to close with a quote from Mark Twain, who once said, often repeated, that history doesn't repeat itself, but it does rhyme. And it's just not clear what kind of rhyme this will be as the story plays itself out. So let me end there. I gave a faster talk than I expected, but that leaves us more time for conversation.